Why didn't I think of that?
Yeah, that's what I meant.
Elevated sed rate indicates inflammation.
Hypersomnia and personality changes point toward the brain.
Not the spleen. Thank goodness we hired a neurologist. Brain symptoms. Could this be a brain problem?
No other systemic signs of inflammation. Probably not vasculitis.
What about parasites? Malaria, Chagas?
But the patient's never been outside of the United States, especially the tropics.
You mean she claims she's never been outside the U.S.?
Very good.
Doesn't matter. Blood and CSF smears show no sign of parasites.
Has to be a tumor then.
A tumor sitting directly on top of the brainstem that 3 ER doctors, 2 neurologists, and a radiologist missed?
Partridge in a pear tree missed it too. Redo the blood work and get a new MRI with 2mm cuts through the mesodiencephalic. And check for evil stepmothers. This much sleep usually indicates poison apples. Anything else besides the shortness of breath?
Not really. It's actually just kind of a tightness.
You smoke?
No, never.
Exercise?
8 hours a day. I teach preschool.
Sounds fun. Any history of heart disease in your family?
Not that I know of.
Take a deep breath. Been under a lot of stress lately?
No more than usual.
You're probably just a little anemic. I'm gonna do an EKG just to make sure.
Do I need to take this off?
No, you can just pull that down in front. Good Lord. Are those real?
Do they look real?
They look pretty damn good.
They were a present for my husband's 40th. I figured he'd enjoy them more than a sweater.
That's so sweet. But I'm afraid the cause of your problem would be staring us right in the face. Actually, I guess I'm the one doing the staring. Of course, I can't be sure. I like to consult a colleague. He's actually somewhat of an expert in these matters. Can I get a page on Dr. Wilson?
A tumor. We don't know. We're checking just to be safe.
You already checked for that.
The previous MRI had a broader view.
Some tumors are almost impossible to see unless you know exactly where to look.
That means it would be small, right?
Yeah.
Then you'd be able to operate. Take it out.
If it's a tumor, there are a variety of treatment options, but there are variables other than just size.
Don't worry.
Too late.
Try to remain as still as possible. The less distortion there is, the more detail we'll be able to see.
Okay.
Well, that's what breasts look like.
Is a lie if everybody knows it's a lie?
Well, if a tree pretends to fall in a forest, House, come on, they're breasts. They're a birthday present, not a philosophical treatise.
Lie number one. She did not do that for her husband. She did that for herself. She thinks if she looks different, she'll be different.
No, she thinks if she looks different, she'll be more attractive, which I have to say.
Not to her husband. Cosmetic surgery, so everyone else will look at us differently. Same reason you're wearing that tie.
Well, exactly. That was going to be my next point.
Last 3 months, same 5 ties. Thursday should be that paisley thing.
It's a gift from my wife.
No, it's not. Julie hates green. You bought that yourself. You want to look pretty at work. Wilson's got a girlfriend.
Stop. I don't.
It takes 2 department heads to treat shortness of breath. What, do the complications increase exponentially with cup size?
I want an EKG and blood test, including tox screen on Mrs. Exam Room 1.
You're ordering tests to cover your lechery. Interesting.
Very tricky case. You love everybody. It's your pathology.
There were no lesions and no mass effect that we could see.
What does that mean?
It means we're still not sure.